Hey guys, it's Gianna, Midwife Fay. Today I wanted to talk a little bit about when not to go to the hospital. So kind of the opposite of my sure signs of labor video, I want to discuss what are common scenarios that I see women come to the hospital for to triage and it's not quite time yet. Let's get into it. So let's first talk about why it's so important to get to the hospital at the right time. Ideally, you want to get to the hospital when you are in active labor and not before. And that's for a few reasons. One, literally labor and delivery is the only time people want to be in a hospital, period, right? So why would you want to be in a hospital, a place for sick people, all of that longer than you need to be, okay? We want you to only be there for the time that we need to care for you, to care for your baby. Okay, so that's kind of a first obvious reason, I guess. Secondly, is when you arrive to the hospital in active labor, that decreases the chance of a lot of things. It decreases the chance of unnecessary interventions in labor, including cesarean. It decreases the chance of infection for you and baby. So there's a lot of motivation to get to the hospital at the right time and not too early. Because of how busy hospital L&D units are and because of goals to decrease C-section rate and intervention rate, lots of hospitals have implemented kind of strategies to discourage admitting people before active labor. Okay, so what does that mean? Active labor for a first-time mom is defined as 4 centimeters. Okay, so here's our cervical dilation wheel. And so here is 4. This is 4 centimeters, okay? And for someone who's giving birth before, active labor is defined as 6, okay? So that's just kind of the textbook answer as to when we want to admit people. So what are reasons that I see people come into triage for that don't match up with active labor in this 4 or 6 centimeter picture? The first thing I see a lot, and is probably one of the most common, is premature rupture of membranes, or PROM. Please, if you didn't watch my water broke, what do I do now video, please go watch that. I talk about it in more detail there. But basically, premature rupture of membranes refers to when your water breaks without labor contractions, okay? So this means that you've got a clear gush of fluid, it's been confirmed by your provider, or it's just obvious, but you're not feeling anything yet. You're not feeling tightenings, crampings, painful contractions, nothing. That's called premature rupture of membranes. Now, my caveat is, yes, if your water breaks at any point, you're going to call your provider. You definitely call or page your provider, let them know. I want you to know your GBS, your strep B culture status. That's going to be important to know when making this decision. But if you're GBS negative, low risk, pregnant, your water breaks and you're not having contractions yet, you don't necessarily need to come in, okay? This is, again, something you'll discuss with your provider, but usually when people come in this scenario, their cervix isn't dilated yet, and we don't want you to just sit in the hospital and not be in labor. Now, once your water breaks, the risk of infection does go up, but it goes up also for checking you. So if you're at home, no one's checking your cervix, right? If you're at home just relaxing, eating, sleeping, especially if it's in the middle of the night, go to sleep after calling your doctor, right? The infection risk goes up, we know, according to data, approximately 18 to 24 hours after your water breaks. I'll have a link below to the evidence-based birth article on premature rupture of membranes and all the good data we have there. Because again, just because your water broke, if you're not having contractions, you're not quite in active labor yet. So again, I want you to call your doctor. I want you to know your strep B status. I want you to make sure baby's moving. I want you to look at the color of the fluid and definitely note the time. But you might not need to go into the hospital right now just because your water broke. The second scenario I see all the time is irregular contractions, okay? People that are just so excited to meet their babies, and I know, I get it, especially first-time birthers, or people who've had babies before, myself included with this third one, we're tired, you know, I'm tired. When I start to feel contractions, I'm gonna want this to be the real deal, so I might come in a little early, okay? So let's talk about irregular. When we say irregular contractions, that means they come and they go, not on a consistent pattern. Most pregnancy apps have a contraction timer. If not, you can use a contraction timer. And what you're doing is you're timing from the start of one to the start of the next one, okay? And you should see a dependable pattern. So their first 20 minutes, 15 minutes, 10 minutes, whatever. So if you have some that are 10 minutes apart, and then there's like 3 really intense ones 3 minutes apart, and then it's back to 20 minutes apart, and then there's 2 intense ones that are 4 minutes apart. That's what we call irregular, okay? Not cyclical, regular contractions that each of them is equal in intensity, equal in discomfort, and they're regular. They're coming at every 4 minutes, every 5 minutes, okay? If you're having irregular contractions, not the time to come into the hospital. What I like to say, and some people might think this is weird, but it's totally how I feel about labor. You know, again, you start timing your contractions, you're doing it with your app or your partner's doing it, whatever, okay? The irregular ones that a lot of people come in for, you know, I see them, they check into triage, they pull up their phone, they're like, yeah, so they were every 5, they're every 4, oh look, I'm having one, and they're very conscious of it happening. I don't mean to be mocking people, but that's generally how people sound because they're excited. That is great, but that is usually not a sign of active labor. If you can be so conscious and so invested in what does the app say, let me pull it out, let me touch my belly, the real regular contractions are going to be strong and require your attention. Your partner is probably going to be having to report to me and to the hospital staff how often they're happening. I often say active labor and true labor contractions feels like you are vomiting through your vagina, okay? So I say that to say, you know, when you're nauseous, you can like say, oh, I'm nauseous, I feel it, I'm nauseous. But when you're actually vomiting, everyone can tell, everyone can see it and know it. You don't have to question it. So irregular contractions that you can text through and keep track of on your phone and be aware of, those ones could be the start of labor, but not a reason to come in to the hospital right now. The last big thing I see a lot in triage is mucus plugs, okay? A lot of times people come into the hospital because their mucus plug came out. What is the mucus plug? The mucus plug is like a collection of what it sounds like mucus that kind of holds the cervix shut. Let me get my little baby and cervix. So the mucus plug is something that can come out all in one piece or over time. And it is definitely a change that signals your body is getting ready for labor. But it does not mean you need to come to the hospital right now or that you are in active labor, okay? Here's my baby and my cervix and the hole in the bag. Oh gosh, that's horrible. Here's my baby and my cervix, which is closed right here, okay? So usually at the opening of the cervix, there is an accumulation of, we call it mucus, but it's a lot of different things there that has kept the cervix plugged up and tight until labor is going to come, okay? So again, in those latter weeks, days of pregnancy, that plug can start to come out, okay? Again, either it's one time and people describe it kind of like nose mucus, or it's continually happening, not like a leaking like when your water breaks, but just like increased discharge over time that looks mucusy. That is not a reason to come to the hospital, okay? Yes, that is a sign that baby is coming lower probably, that your cervix is getting ready for labor, but you don't need to come. Also, you don't need to bring it. I've had people bring their mucus plugs in Ziploc bags or bring photos of it to show me. And if nothing else is going on, if you're not really having those regular strong contractions, if your water isn't breaking, if you're not having any vaginal bleeding, a mucus plug alone is not a reason to come in to the hospital. So my biggest tip for you is when you think you should go to the hospital, a few things. Look to see, are your contractions regular? Not, some of them hurt, some of them don't, some of them are regular, some of them aren't. They all need to be regular and follow a pattern, okay? Call your provider. Oftentimes, we are really good at over the phone assessing if you're in labor or not. No, we can't check your cervix over the phone, but we can tell most of the time if someone's truly in active labor, okay? We don't want you to come before necessary. We don't want you to waste your time with multiple trips back and forth. And again, spontaneous labor for you, if you're a low risk, healthy person, is going to be the best for you and for baby. So we really want to make sure you're in true established labor before you get admitted. All right, thanks for watching. I'll see you guys next time. Bye-bye.